Better World is the first European distance higher education activity with the Nobel Prize laureate Mohamed Yunus after the COVID-19 emergency. The first session had a great success. During the session, we had around 1,000 people linked on social media channels and in the meeting. The video of the session will be soon online on the YouTube channel of the University of Basilicata with the record of this video, of this session. Many thanks to the Professor Yunus and to all the participants and to all the people that cooperated to carry out this event, and especially to the responsible of the Yunus Social Business Center of Basilicata, Firenze, Urbino, Venezia and Bologna, and to the Yunus Center of Utaka for sure. This is a signal really strong for the social business. It seems really important to talk about it in this moment of the coronavirus crisis. Today we will have a discussion about these topics: Yunus Center activities and social business and healthcare. The speakers are the Executive Director of the Yunus Center, Ms. Lamia Morshid, the Managing Director of the Grameen Kalyan, Mr. Moin Chowdhury, Acting Managing Director of Grameen Healthcare Service and Chief Executive Officer of Samajik Health Science Institute and Research Center, Mr. Kishwar Madad, and the CEO of the Digital Healthcare Solution, Mr. Sajid Rahman. I remember also that the next few appointments are the 18th of May, Social Business and its Challenges, and the 20th of May, Zenat Islam and Shihab Quader will talk about Yunus Social Business Center Network, and the responsible of the Social Business Center, Italian Business Center, will talk about their experiences. At the end of that session, there will be two really interesting speeches. The House for Peace and Experience of Environmental Sustainability for Human Rights from Mario Cucinella, the architect Mario Cucinella, and the CEO of the City of Peace Foundation, Enzo Curzio, and the new approach to the economy with Father Enzo Torturato, director of the press room of the Sacred Convent of Assisi. Please turn off your microphone and camera to avoid the risk to disturb the speakers. There is someone who has now, I hear the microphone on. Please turn off. Please turn off. I have to remember that this session will be recorded and it is possible to see it on the YouTube site of the University of Basilicata to share it for the use of didactical use. Now I give the floor to the Director of the University of Basilicata, Mr. Giuseppe Romaniello, and immediately after, to the Director of the Yunus Center, Ms. Lamia Morshid. Please, Giuseppe Romaniello, can you open the microphone and start?
Thank you, everyone. Thank you, and welcome to our second meeting. This course is the first step of the activity of the Yunus Social Business Center. All of us know that we need to review, to have another point of view about the global economic system. We need to rethink a new approach to the global ecosystem and climate change. We need to improve our collaboration for rethinking a new way to the economic system. So the aim of this meeting is to have a sort of exchange of points of view. Thank you to the Yunus Center of Dhaka, because in this way, between this collaboration, we can improve the possibility to image the activities of the Yunus Center in Unibus. Thank you to the other points of the network, Italian network, the centers in Italy, the academic centers in Italy. And thank you to the stakeholders. First of all, the local stakeholders. We need of this collaboration for imagine together a good steps after this course. So my speech is a very brief welcome to say good work to everyone about our approach to rethinking a better world. Thank you so much.
Okay, thank you so much, the director of Unibus, Romaniello, and now I give the floor to the director of the Yunus Center, Lamia Morshi.
Hello, can you hear me?
Yes, absolutely.
Okay, it's a great delight for me to
turn off your camera. Turn on your camera. Excuse me. Turn on your camera.
Okay. We are very pleased to be undertaking this program together with the YSBC at the University of Basilicata, together with the City of Peace for Children Foundation in Basilicata, and with the other Italian YSBCs to do this 4-day course on rebuilding a better world that was inaugurated by Nobel laureate Professor Yunus a few days ago. It's a great time for us to gather because we have this pandemic and all of this uncertainty for the world, to think about what we need to do now and also in the future. Yunus Center is dedicated to promote Professor Yunus's idea of social business, which is a business created to solve social problems. It is a sustainable business, but whose main purpose is to solve problems. It will charge for its product and its service, but it does not return a profit to its investor beyond returning initial capital. Any profit that it makes goes back into the company to further the purpose of the business, to further the social mission of the business, and to solve the social problem at hand. This was an idea that Professor Yunus did not come up with overnight. Rather, he and his colleagues had created 50 such businesses in Bangladesh, each designed to solve a particular social problem, and some of them grew to become nationwide businesses. None of the investors receive any profits from these businesses. Rather, those profits are used to fuel the social mission of the business. It's a business that's designed to meet the needs of the people. Since the overriding purpose of the business is not to make money for the investor, its entire focus is on meeting the needs of society. As I mentioned, 50 such companies were created by Professor Yunus in Bangladesh. They're addressed to healthcare, many of them, but also to access to education, access to energy, access to clean water, access to technology, but driven always by the needs of those who are traditionally left out. We have created almost that number or more of companies around the world too, following the same principle. Basically, the social problem solving, non-dividend business principle of social business. One example is the collaboration between Grameen and Danone of France, which produces fortified nutritious yogurt in Bangladesh for undernourished children. The kids and the mums in the rural areas of Bangladesh buy the yogurt produced in a specially created factory. This yogurt tastes great, but it also contains all the nutrients that are missing in the diets of the children. This malnutrition is what keeps them stunted and also vulnerable to disease. Grameen and Danone make no money from this venture. Instead, it helps to bring the kids out of malnutrition. Their bottom line is not how much money they're making for investors, rather, how many kids did they bring out of malnutrition that year. More than 300,000 rural kids in Bangladesh consume this yogurt regularly. We feel that the need for social business has been highlighted greatly during this pandemic, as conventional business or conventional way of doing things have not been able to meet the needs of society. Even in the wealthiest countries, the system as it is now could not protect doctors and nurses with protective gear and the right type of equipment to carry out their responsibilities. Even in the wealthiest countries, there were not enough testing kits, not enough PPE, not enough ICU beds, not enough ventilators to protect frontline workers and ordinary people from disease and from death. In Bangladesh, we tried to respond to COVID epidemic by turning our facilities and resources that we had in hand to help those in need. We transformed our garments factory into a PPE gown producing factory to protect frontline workers and also the law enforcing agencies. More than 50,000 of them were produced and more are going to be produced. We imported medical masks and made those available for medical workers. We are now producing 1 million non-medical masks, so those who cannot afford masks in hard-to-reach areas can be protected. We will continue to produce those. At the same time, because the country has been in lockdown for 2 months, hundreds of thousands, especially daily wage earners, have completely lost all income. Grameen has initiated a cash transfer and food support program for 15,000 families for 3 months, for a 3-month-long period for the neediest people in society. It was able to undertake these actions because they were mission-driven businesses that are characterized by the agility and efficiency of business, but already geared towards tackling social problems and crises. The fact that social business works from the bottom up meant that we had the networks available to us to reach our support even in the most remote areas. In a recent write-up that Professor Yunus has written called No Going Back, which was actually first published in La Repubblica in Italy, and maybe some of you have read it, but now also in many other papers around the world, he says that the pandemic gives us a chance to break from the past. He said that the world as it was before had created so many problems: environmental destruction, unsustainable wealth concentration, the prospect of massive unemployment due to AI as a way of profit maximization. He said that we should not go back to that world. He stresses that we should redesign policies and institutions so we do not continue on the same track as before the pandemic. As long as economics remains a science for profit maximization, he writes, we cannot rely on it for a reconstruction program, which should be based on social and environmental consciousness. The whole strategy would be to enlarge the proportion of social business as the total economy grows. Social business can engage themselves in creating a robust public health system in collaboration with the government system. I'm very happy for today's event. We have engaged all of our YSBC partners in Italy, YSBC Basilicata, YSBC Urbino, YSBC Firenze, YSBC Bologna, and YSBC Venezia. And also we are engaging the rest of our 82 YSBCs in 31 countries, as through their programs and curricula, we can seed the ways to the new ways of thinking, the new ways of doing things, and the new way of doing business as exemplified by social business to create a newer and more sustainable world. Thank you.
Thank you to Director Ramia Morshid. And now I give the floor to the Managing Director of Grameen Kailian, Mr. Moincho Ari. Please turn on your microphone.
So I should be turning on my microphone, not the video? Yep. Can you see me?
Also the video, excuse me.
All right, thank you. So thank you so much. I'm Moin Chaudhary. I'm Gramin Kollan, Managing Director. To start with my presentation here, I would just like to give you a bit of background as to what this company is. This is a healthcare company which was built by Professor Muhammad Yunus. In 1993, Nobel laureate Professor Muhammad Yunus experimentally started a program called Rural Health Program, RHP. And the goal of this program was to provide quality health services to rural poor, along with the Grameen Bank borrowers, by qualified medical personnel at a very affordable cost. That was the beginning of Grameen Health Initiative, and later in 1996, Professor Muhammad Yunus established it as a company named Grameen Kollan. Grameen Kollan means well-being, which is a non-profit company, and it aims to undertake and support sustainable programs to improve the livelihoods of the rural people and to minimize the health inequalities between rural and urban people. And it, as Lamia already said, it operates as the social business for our Grameen group. As on today, in Bangladesh, we are operating in almost 27 districts out of 64. So we are covering almost 42% of our country with my health centers. These are small health centers where we independently give treatment for the primary health care, just for your understanding. I would like to keep it a bit short because what I would like to say more about what we are doing during this period, this pandemic COVID period. So, like any other country, we were quite taken aback. The government was not effectively prepared at a very early stage, but later on things have improved and things are coming into control at this stage in Bangladesh. But as a company like Grameen Kollan, we prepared the leaflets, flyers from January 2020 about COVID-19 to aware our urban, semi-urban, and rural communities, which really acted quite good, but they were not very serious about it, for sure. Then we also disseminated World Health Organization's guidelines up to the grassroots levels, just to make them aware as to what we should be doing at that point of time, especially on hand washings and your social distancing. We also kept health workers, especially my health workers, which is almost around 1,200 people in my company. So I kept them motivated by giving them protective gears. I've kept the health centers open for poor community, whereas some of the health institutes started shutting down out of fear of COVID. We have guided our patients for centralized COVID testing in the capital city. When I call them about protective gears, I must say that this is PPE. I never knew, maybe my people didn't know what was PPE when the COVID came. But when we came to know, we became very serious. We started giving that to our people. And initially, on 8th March, we had 3 persons in Bangladesh diagnosed with COVID. So within 10 days, our company, Grameen Fabrics and Fashions Limited, they have started producing PPE, and we saved our healthcare workers. And we sent it to them. They never knew who has COVID or who doesn't have, but still, I wanted to keep their morale very high so that they can work for the poor, ultra-poor people across the country. And when they received it, they were extremely happy. They had all the morale support for continuing as the health worker to give support to our people in Bangladesh. And at the same time, I had 175 offices, those who have turned into my channels of distributions. I kept them open through Zoom app, and then I made communications through the Zoom app to everyone there. And for these, we could successfully distribute food items through these distribution channels almost to the 1,100 families. And the Grameen Group has a target of giving food support to 15,000 families across the country, which we are continuing through this COVID period. Again, this was totally a clarion call from Professor Muhammad Yunus, who guided us how to do this, how to do right. And day and night, he had been with us, talking to me, guiding us, talking to our people, keeping them totally, absolutely fit, and moral support was up very, very high. So this is how we somehow overcome our situation, or overcome the fear that we had. At the same time, we also made sure that, as Lamia already said, the Grameen Group has prepared the 1 million double-layered knit fabrics masks, which we distributed through our channels to the ultra-poor people. And we'll be continuing to do that, but for free. For your kind understanding, we gave all this PPE and masks for free to our people. We kept our business running with the hope to help others to be treated and also covered our costs from day-to-day business. As we do the social business, we keep running our money within ourselves and make sure that everything is active. We provide support and people are having their trust on us and coming for their treatment. We are constantly standing beside our community and rendering us support to fight back against COVID and COVID-19 and voicing as well as practicing more on social distancing with everyone. Still, this is continuing. I don't want to continue more because I have other speakers. I would like to finish up here. Maybe we can have questions later on, then we can answer your questions. Thank you very much from my end.
Thank you so much for your speech, Mr. Moin. And now I give the floor to Mr. Kishwar Ilmad, Acting Managing Director of Grameen Healthcare Service. Please switch on the microphone and the camera.
Can you hear me? Hello? Hello, I'm Kishwar speaking. Can you hear me?
We can hear you. You can continue.
Yes, we can hear you.
Okay. Good afternoon, ladies and gentlemen. First of all, I'll try to give a brief description and activities of the Grameen Healthcare Services, Samajik Health Complex, and Grameen Caledonian College of Nursing, which is our sister concern. And secondly, would like to give a brief idea about what are the measures we have taken to prevent current corona pandemic situation and our food support program for the community. And finally, if time permits, maybe we can discuss about future lifestyle to prevent infectious disease. So Grameen Healthcare Services is a social business enterprise established in 2006 under Bangladesh Company Act, initiated and inaugurated by Nobel laureate Professor Muhammad Yunus. He's the chairman of our board of directors. Grameen Healthcare Services is a member of Grameen family, operating successfully by adapting the concept of social business and cross-subsidy model. 4 companies of Grameen family: Grameen Telecom Trust, Grameen Kullan, Grameen Shakti are the stakeholders. In fact, they invested to establish this company. Now I talk about why Professor Yunus actually established Grameen Healthcare Services. More than 1 million people, 1 million adults and 50,000 children in Bangladesh are blind. And 80% of these blindness are caused by cataract alone, which is preventable and curable through proper treatment. And approximately 42.5% people over 30 years of age are suffering from refractive error, or we call presbyopia. To overcome this social problem and to achieve the target of Vision 2020, we need to perform 33,000 cataract operations per 1 million people per year. When the Grameen Healthcare Services were established, the cataract operation capacity was very low, only 1,200 operations per million per year. In last 1 decade of the establishment of healthcare services, the capacity of cataract operation has increased to 2,000 per million. Still, we have a long way to go to eradicate the needless blindness in Bangladesh. So our vision is to ensure quality healthcare services, affordable to all, and to eradicate the needless blindness in Bangladesh. And with these objectives, with this vision, we have set our objectives like establishing healthcare facilities, like establishing eye hospitals where people do not have access to eye care services, establish vision centers, establish eye care institutions, providing professional training to the doctors, because we have very few doctors comparing to our population, and building awareness to prevent eye care diseases. So at present, Grameen Healthcare Services at 4 hospitals established in different time in last 1 decade, starting from 2006. First one we established in Bogora district, second one in Borishal, third one in Thakurga, and finally last Finally, we in this year we established another one at Satkhira districts. We have 26 physicians, 153 nurses, 105 admin and support staff. Altogether, 280 employees are serving in this hospital, and most of them have actually received training on healthcare services. So we actually try to develop the healthcare professionals as well. And in our 4 hospitals, we have 225 beds, including wards and cabins. So far, Grameen Healthcare Services treated 1.8 million patients, performed more than 75,000 surgeries, and 20,000 other surgeries. And we provided free treatment to 48,000 patients and performed 8,000 free surgeries. And these surgeries are supported from a fund we call Eye Care Support Surgery Fund. We provide consultation, counseling, investigation, lab pathology services. We offer cataract, phaco, DCT, DCR, all types of eye surgeries. We regularly send our doctors and nurses in the rural area to perform eye camps, school site programs, eye screening for the factory workers. All our hospitals have spectacle and medicine dispensing centers or shops. We have small consultants in our hospitals to provide free telecounseling to the patients, particularly patients those who are reluctant to perform cataract surgery. Now I'll talk about Samajik Health Complex. Samajik Health Complex is actually a recent project of Grameen Group, Grameen Kullan, Grameen Telecom Trust, actually invested, and Grameen Kullan. These 3 companies actually invested to establish this complex. It's a complex comprised of 500-bed multidisciplinary tertiary care hospital, medical college, and a medical technology institute. Samajik Health Complex will be managed by a company. It's called Samajik Health Science Institute and Research Center. And this is also a social business company. The project will be completed in 2 phases. In the first initial phase, we build the infrastructure facilities of a nursing college of 900 student capacity, and with a female hostel of 700 bed capacity. This project is almost completed, but for this pandemic situation, we could not start the operation of this college. In fact, Grameen Caledonian College of Nursing will be relocated, supposed to be relocated in this college in this by July, but maybe if situation allow, we'll move in by end of this year, move the college to that new location. In the second phase, company is in the process of construction of a 500-bed teaching hospital with multidisciplinary tertiary care facilities, a medical college of 500 student capacity, and a technology institute as well. And the second phase, the construction of the second phase will be completed, expected to be completed by 2023. Grameen Caledonian College of Nursing, which I told earlier, is a sister concern of Grameen Healthcare Services. At present, the Nursing College offers 3 years diploma and 4 years bachelor's degree. The college was established in 2010. Until last year, till December last year, 444 students graduated from this college, and 500 students are still enrolled in BSc, nursing, and diploma courses. We have collaboration and exchange program with the Glasgow Caledonian University of Scotland, UK, and 6 students from this college went to Glasgow Caledonian University to complete their BSc degree, and 4 students completed their nursing degree, MSc degree in nursing, and when they come back to Bangladesh, they join as a faculty member of the nursing college. Finally, I'd like to give you a brief idea about what are the measures we have taken to prevent the corona pandemic situation. We regularly performing health screening of each and every patient and their attendants through measuring the temperature, assessment of symptoms, and all the patients and visitors have to wash hands with soap and to wear face mask before entering to the hospital, and they have to maintain social or physical distancing while waiting in the OPD area. Our counselors and nurses are regularly providing counseling service about health hygiene, measures of infection control, and importance of maintaining social distance. You know, in the rural area, people are not that much educated and not that much social health conscious. So we thought that this is a very important measure we should take to educate our patients about personal hygiene and maintaining social distancing. All the patients are also given non-medical masks free of cost. From April, we have started distributing food package program, which Moin already mentioned. Most of the Grameen companies are distributing food support. So we also participated in food distribution to the poor families, those who have no savings or no other way of getting any financial aid or relief. So far, we supported more than 250 families in 4 districts and have a plan to provide the food package to 450 families till June 2022. And we have an affiliation with Arvind Hospital, Eye Hospital in India, Orbis International, and Sheva Foundation of USA. We welcome operational partnership with foreign organizations and hope to excel in future. If you have any questions, we can actually answer those later. Thank you for now.
Thank you so much, Mr. Kishwar and Madad. It's very interesting your session because you show how big could be the support of the social business in this situation. Now I give the floor to Mr. Shadid Rahman, and after there will be questions. So if someone will send us a question, we will give the floor at the end of this intervention. Please, the CEO Digital Healthcare Solution can turn on your microphone and your camera.
Thank you. I hope you can hear me. Thank you for this.
Yes, we hear you. Yes, yes.
So thank you for this opportunity, and I hope you're all staying well, staying safe. So I'm going to talk about 3 things. First is what we are all about, this whole digital healthcare. Second is, of course, what we are doing during this unprecedented time in our history. And third is where we see the healthcare evolving. What is the outlook in the post-corona world? So, I mean, we started as a health tech company out of a telco, Telenor, which is a Norwegian telco. And the whole idea was that if everyone has a mobile phone, which is almost everyone in our country, why can't that person has access to the quality healthcare? If a person carries something like a mobile phone on their hand, that person should also have access to the quality healthcare every human being deserves. So we started building a proposition, and we very quickly launched and came across almost 8 million people coverage very quickly. However, this growth was too fast for a telco company. And at that point, Professor Yunus stepped in, and he said that he would like to take over this business. So we are now part of the Grameen Trust. And it fits in with Professor Yunus's vision of how a healthcare should be, which is a person should be staying at home and will have access to the same level of healthcare if the person goes to a hospital. So every individual houses from their home, from the quality and the comfort of their home, gets the same level of healthcare. And that's the grand vision Professor Yunus gave to us, and to build a business along that line. Our targets, our ambition, our making the healthcare accessible to millions remains same, but we are now a social business, operate under a social business philosophy, and with a large goal of connecting the technology with the Grameen Kallans and Grameen Healthcare offline, the brick and mortar businesses or the services that we have built. So what actually we do? We initially focused on, and still a large focus is on non-communicable diseases, i.e. high blood pressure, diabetes, cancer patients, kidney problems, all those patients. And we first, of course, have a big vertical on the content, how to make sure a person lives the life in such a way that the person does not end up in hospital. So that's the first big vertical. The second vertical that we have built is access to healthcare, to doctors over phone, video, chat. We did almost 1 million such consultations, and in the process, we create a health record of almost 400,000 people. all these electronic health records give us a very good data and idea of what are the disease nature at a society level. Of course, with this healthcare, we also connect people with the hospitals. We connect people with appointment booking. If necessary, we collect samples from the home. We have a partnership with that. And of course, there are many other areas that the second vertical continue to expand. The third one is health insurance. We have people in Bangladesh and in many markets where they don't have a basic healthcare coverage. So a person becomes ill, and the person ends up in a hospital, can't pay for the expenses, ends up selling their lands, their houses, and go below the poverty line. So we brought in a health insurance, and we are the largest health insurance provider in Bangladesh in a very short time. We now cover almost 5 million people. So that is what we built. But when the corona disease came in and hit our country, the first thing we did, and Professor Yunus was very clear, he said that just go on and build. This is a wartime. This situation is like a war, and move very fast. So we built what we call Corona Care, a comprehensive package to fight corona. It all started with, I'm sure most of you have seen, something called symptom checker, a person which is in local language. So a person goes in, checks symptoms, and see whether the person has corona or not, at least the symptoms of it or not. And we have almost 250,000 people who did this checker. And from there, if a person needs to talk with a doctor, or consultations, or anything, the person gets connected to a doctor. And from there, if the doctor feels the person needs the test, go to a testing site and takes the test. And of course, one of the big challenges for many markets, including Bangladesh, is how to ensure social distancing, especially in the context that a lot of people live on a day-to-day wages. So that's where we have come in and launched Corona Insurance, where even a person is isolated at home or hospitalized, and in the worst case of death, they get a health and the life insurance. And we have given first 100,000 of this insurance free, funded by Grameen Trust. So that's what we have built. What we are working now, and which is in the pipeline, and we're talking about not months, but days and weeks, is that we are in the process of taking over this national health line, IEDCR, which is essentially the health line or the first contact point across the nation. So along with Johns Hopkins University of US and USAID. So we three have partnered to take over and really up the game there. We are in the process of setting up some testing booths with a hospital called Mugda. It's one of the prominent Corona Care Center in Bangladesh to collect samples and ensuring with a partner that the tests are done. And this booth also has a triage with a doctor consultations over videos. And then, of course, we are working with partners like Defeat, empowering 100,000 community health workers so that they can go into the remote areas of the country and really help. So these are the things that are pipeline and are coming into place in the next couple of weeks. Now, let me tell about what we think the healthcare would be as we go through this phase and hopefully go beyond the post-corona world or post-COVID world. As Professor Yunus mentioned, this is going to fundamentally change of how we see the world as an individual level, at a community level, and at a country level. I think it will fundamentally transform, and it's a clarion call from Professor Yunus, is to rewrite the order of the world, because this is a crisis which we should not waste, as someone once said, because I think never in our history, healthcare has been so much at the center of discussion. If you look at any country's budget, healthcare and education is usually not at the top, but somewhere in the middle or at the bottom. It is time to bring healthcare education at the top of the budget and give the real priority to the people, to the scientists, to the researchers who are actually at the front line, to the health heroes, and make them a part of the discussion of how the healthcare should be designed in future. I think this crisis also bring out something very unique, which is the collaboration across countries and across research institutes that we are seeing. We are seeing the way and the speed with which some of the developments have happened in terms of finding the sequencing of the virus and the research on the vaccines and the way the different treatments are coming out is unprecedented. This level of global cooperation has never happened before. And I think this sets a precedence of what the world we want, a world where everyone is cooperating to solve problems, where the science and the research and the focus on solving problems is at the top, And the people who are doing these things, who are the health heroes, are at the center of discussion. And I think this whole thing, the technology can be used in the good ways and the bad ways. And we are now saying what is the good side of technology. And in the healthcare ecosystem, the technology will be at the center and the forefront. Because at the end of the day, technology can be a democratizing force, taking some atoms and converting into digits and really spread it to millions of people without increasing cost. And that's where I think technology will become very much at the center of healthcare. And we are going to enter a society where healthcare is accessible to everyone, whether that person is wherever in the society or whichever corner the person is. The person has an access to the quality healthcare as every individual in this world deserves. Thank you.
Thank you to you, Mr. Rahman. It was really interesting, and at the end, I will take a question to you. But now I have to give the floor to the first question. Is Federica Honori, PhD, a student, University of Rome. Please turn off the camera and the microphone. Federica Honori, please, can you turn on your camera and your microphone? No. So I shifted to the second question. Maybe after we can have Federica Honori. So Stefania Carbone is one member of the foundation, the City of Pisa Foundation, and she has a question.
Hi everyone, can you hear me?
Yeah.
Okay, so thank you very much for your intervention, very interesting and very powerful. And I have a question very general. So the COVID-19, the health emergency that we face, all over the world, in Italy highlight the struggle and the difficulties of the private healthcare system compared to the public health system here. So do you think that the social business approach can be a more efficient solution in this regard in order to ensure high level of healthcare assistance? Thank you very much.
Who can...
Okay, this is Moin. I will take the question. Thank you. Thank you so much. It's a very interesting question. The social business is a business where the company is designed to grow itself by the investment that we have, and gradually it grows. So what we do with the investment, for example, like if there is an investment in this company, we do not share the profit with anybody. That's against the social business law. So what we do is we keep the money within ourselves and make the company bigger. Take an example of my company. Like I am a primary healthcare services provider, and I have reached almost up to 42% of my country. And if you have 64 districts, I have gone up to 27 districts. This is because we had the money, we distributed, and we tried to bring out more of services to the people of our country. But when it is a single owner's business, what happens is he looks after the profit. If the profit is not there, look at the systems now, how it is collapsing. Like in different healthcare industries, people are losing their job, even in healthcare industries, because they can't cope up with the money that they have. But in social business, what happens, one brightest side is like the money rolls within itself, and we think of giving more service than having or sharing the money within the shareholders. That is something that I would really admire, that how Professor Yunus has come up with this principle. And for this reason, if we follow the social business concept, like what we are coming up with a business very soon, by, as said by Mr. Kishwar, that our Gramin Health Complex, where we are having a 500-bed hospital along with nursing institute, then your health medical college, research training institute. All this will come up at a very large scale, so that we provide services to all walks of people of this country. And this is only possible because we wanted to do this service to the social business concept, not a single profit owner business where he will share the profit. Either he doesn't share. that is something not within us. So we are totally out of it. And I totally believe if you come up with a system like this in your country or anywhere, I'm sure this healthcare business will become a very strong services that can render proper service to the people. At this stage, the whole world needs this kind of service for the healthcare business. Thank you very much.
Thank you to you for this answer. Is there anybody that wants to answer also?
Hello, yes, I want to talk about it actually. In Bangladesh, actually, if you look at the health access to the healthcare access to the people, it's actually very few people can afford to go to tertiary level hospital when they have a really serious disease like cancer or non-communicable disease, heart disease, performing a heart operation or treating a cancer is not possible for a people from low income group. So the hospital that Moin mentioned, that we are going to build a hospital for middle and low income people in Dhaka city, where the patient will have access to all type of patient will have access to get the treatment facility from this hospital. And if this hospital is built up in a traditional concept like profit oriented company, then the ICU expenses will be high, emergency services will be high, operation cost will be high. So people won't be in Bangladesh, since there is no health insurance system. Very few people have insurance, like those who are working in access to very few people have access to insurance. And recently digital health started this as Sajid said for the low income people, but that's very few, that's not enough to get access to tertiary level care. So this since our hospital will be is a social business, we will actually as you said, our vision is to make accessible to all types of people to have tertiary level healthcare. So this is an unique example of providing services, creating access for the middle and low income people for healthcare. And in our hospital, as I mentioned, we are providing free operation, a cataract operation for the poor people. So in a traditional profit-oriented hospital, it's not possible. They won't allow anyone to have a free, cataract operation. But if a person cannot have access to cataract operation, he will be blind. He will be burdened to his family. So I think we should concentrate more on social benefit, especially when it comes to healthcare, because healthcare is a right. And if you build hospital, especially private hospital, in a traditional concept, profit-oriented concept, and people will not exercise their right. And in the government hospital, the care is not that much. So even people go to the government hospital because, but they are not having access to tertiary care, quality, I would say quality healthcare. So social business can play a very vital role, especially after this pandemic situation, to create access for everyone to have tertiary care or healthcare services. Thank you.
Thank you for your answers. And now is the time for Federica Nori. You can switch on your microphone and your camera, please.
Hello, thank you. And thank you to all panelists for their valuable contributions. So my question is still about profit and how it relates to social business. So social business is not meant to create profit. Nonetheless, if it's a business built for helping people escaping from poverty, then the business is allowed to produce a profit. So my question is, how can we understand, how can we decide if a poverty situation actually holds. So is there a precise definition of poverty? Is there a threshold in terms of dollars or social conditions that we can use so that we know that, yes, this social business can create profit, is allowed to create profit or not? Thank you.
Okay, may I answer this question?
Okay.
Yeah.
Hello?
Yes, please go ahead.
I'm Kishwar actually. I want to answer your question. So you asked that if we create access to healthcare for the poor people, and how we'll make the hospital sustainable. Is that you meant?
No. So I didn't refer specifically to hospital, but in general to social business, who they generally are not meant to create profit. They are meant to solve a social problem, right? And profit is not allowed because any gain should be divided and used so that the business can eventually become bigger, let's say. But so I'm reading the books from Professor Yunus, and this is where my question comes from. Sometimes a business is meant to help poor people to escape from the poverty situation. And in this case, poor people who participate this social business are actually allowed to gain something, so to have a profit. So my question is, how can we understand if a situation is such that profit is allowed? Is there any precise definition of poverty or any specific threshold, for example, in terms of dollars per month or per day, don't know, or social conditions that can allow for profit in a social business context?
I can attempt to that.
Yeah.
Okay.
Lamia.
Lamia, you want to answer?
Yeah, I want to say, well,
Turn on the camera, Lamia.
So the thing is that a couple of things. One is that social businesses per se are not necessarily just poverty focused. Social businesses are businesses that can be addressed to any social problem. It can be even curing drug addiction for the rich. So social business is not necessarily just for poverty reduction or poverty alleviation. It can be for any social problem. It allows profits, but the profits are not given to its investors beyond the initial capital. You can return the initial investment. Any profits that are made beyond that by that company go back into the company to extend its size and reach and amplify its impact. So that's on the social business thing. But the very first social business that Professor Yunus and his colleagues created is Grameen Bank, the microcredit bank that's very well known. And that was focused on poverty. And it was basically targeted only to poor people. And the Grameen Bank actually defined very clearly who the poor are to receive the credits. There was a measurement of landlessness in Bangladesh. Ownership of land is an indication of whether somebody is poor or not. There was also an assessment done of what the household possesses in terms of material things, how much income they have, the quality of their house. So there were 10 indicators that Grameen Bank looked at to identify who were the poorest. So very clearly, and in fact, with the microcredit and with taking bigger and bigger loans, the progress of that family out of poverty was also measured against those 10 indicators. They did not have a mosquito net before, now they have a mosquito net. They did not have 3 meals before, now they have 3 meals a day. They did not have their children in school, now they have their children in school, etc., etc., etc. So very clear 10 indicators for measuring poverty and also for measuring the progress out of poverty. And then in terms of the profits that they can make, yes, of course, the purpose of the Grameen Bank was to give them an economic opportunity to get profit and income for their families. So they did not have access to affordable credit, but Grameen Bank made that possible for them to do that. And with the income generation activity that they invested in, it allowed an income and a profit for the family so that they could meet their basic needs. So the Grameen Bank itself as a social business cannot make profit to any private investor, but the beneficiaries, the women who are receiving the money, of course, can make a profit, because that's the purpose, is to help them increase their income and profit so they can sustain their livelihoods.
Sure. Thank you very much.
I just wanted to give you an example of that. What I do is like, say, we do the social business, but we try and help our Grameen Bank borrowers' children to take money from us, like as 50-50 participation. Say if he takes, say, $100, I give him $100. If he has saved $100, I give him $100, and he buys a cow, and then he makes it bigger. And when it gets bigger, then he sells it to our, there are festivals like Eid al-Adha, where in the cow market, they can sell almost 2 times, 3 times more the money that he earns. So he makes money out of it. He sells it, again, buy 2 cows. So this is one example how we help the entire community in our country, where we call entrepreneurship creations. As Lamia said, that social business is always directed towards any sort of problem that threatens the society. For example, say arsenic problem. Say there are water where we can't drink, be it rich or poor, it doesn't matter, but you can't drink that water. So you come up with a solution, which is a business through which you improve the society by treating that arsenic problem. So social business is always like you try and attain something with an investment that brings up clear objectives for the society to come out of it and stay absolutely happy and free of any kind of social problems. Thank you. I hope that satisfied you. Thank you very much.
Thank you. It was really clear, the answer. And so I think the last question could be mine. I heard really with interest the speech of Mr. Sajid Rahman, because in Italy we are talking about a lot an app that the government will use to check if you are affected or not by the virus, if you are connected with people that has already the virus. So is a really top-down approach, opposite to the approach that you used with an interactive app. And I'm really interested about this. What do you solve the problems with the privacy with this app? Because this in Italy is a very sensitive, and in the Western country is a sensitive problem.
Sure. So I think what you're referring to is a contact tracing app, which different companies are struggling with. I know Germany had challenges with the one Google developed, Google and Apple together, and so ultimately they agreed, I think, with the Apple guidelines and stuff like that. So, and separate countries also have the challenges. What we are doing is a HIPAA compliant. So all the consultations, all the checks done is as per HIPAA compliance, and complete secrecy and privacy are maintained. So at the end of the day, we are very careful of the data that we receive and keep a complete privacy of that, to the extent that an individual can actually at any point of time ask to delete his or her data. So if an individual says, okay, please delete my conversation with the doctor and stuff, it gets automatically, he or she can delete it. So yeah, so I mean, I think privacy is, I can understand the dilemma many countries are facing, because globally it is a hot topic in context of contact tracing, at where to stop and where not. I know there are a couple of developments happening where the Bluetooths are being used for contact tracing, where a person who would use opt-in method, so a person can decide whether to whether to activate the Bluetooth or not, and the Bluetooth cannot actually identify the individual of the location. So there are a couple of workarounds that different companies are working on, but clearly, I mean, this is a very fine balance. And all our activities so far has been very clear. We don't want to do anything that compromises the privacy of an individual. So all our propositions are built that way.
Thank you so much. So I'm asking if there is some other question. Otherwise, we have to finish this second session.
I had just one point. This is Lamia speaking, which Professor Yunus wanted me to add at the end of our discussion. which is that, my colleagues, they mentioned all the healthcare programs that are being created in Bangladesh, the ones that are there, but also the mega projects of hospitals and nursing colleges and tertiary care establishments that we are working on. And he was basically saying that we would invite any Italian organizations, healthcare institutions, to participate and collaborate with us on those projects. We would be very happy to work with you in Italy, but also we would be delighted if the University of Basilicata and the constellation of organizations that are assembled for these meetings, to see if there are ways for Italian institutions also to work with us in Bangladesh. Professor Yunus had specifically asked me to mention this.
Thank you very much, Professor Yunus again. And for sure, we have some examples of similar activities in Basilicata, and we will try to involve them in our plans and projects together with you. So, thank you to all of you. It was a pleasure to stay with you, and it was very interesting your speeches. So, the next meeting will be the 18th of May, and with the topic social business and its challenges. So, it's more focused again on social business. Thank you to all of you, and see you soon. Bye.
Thank you. Thank you very much.
Thank you very much. Bye-bye.
Bye.
Thank you. Bye.